currently taking a master's degree program at the University of Illinois at Chicago to become a family nurse practitioner. Do you know about family nurse practitioner?
No.
Okay, when I'm done as a family nurse practitioner, I should be able to make write prescriptions, make referrals, as well as make diagnoses and work with a group of doctors. And today in the process of this interview, I'll be asking you some sensitive questions. I'm not doing it to be funny, but just to get some vital information that will help me to make decision about your health needs. And whatever we discuss today will remain completely confidential between us. And it's just that one or two of my instructors in school might be looking at it. Okay? I just want to know, how do you want me to address you?
Just call me Rose.
Okay, Rose, can you tell me why you're here today?
Well, I'm here because I have pain at home.
Could you please describe exactly where it's hurting on that right shoulder?
At this junction.
Okay, on top?
Yes.
Okay, what makes it worse?
Well, activities.
What makes it feel better?
When I was walking.
When did this start?
Since 3 days ago.
Okay. When last did you see a doctor?
Well, in 2011.
Could you please tell me why you went to see a doctor?
Well, I had pneumonia.
Can you please give me a little description about the pneumonia?
Well, I had pains in my lungs and fever.
And when did that start in 2011?
Well, I would just say recently, the month of February.
So how long did it last?
It lasted for about 10 days.
What makes it worse?
Well, I would say when I'm exposed to cold.
What made it better?
When I took treatment.
Okay, is there some, are you allergic to some kind of penicillin?
No.
Are you allergic to some kind of latex?
No.
What of allergies to food?
No.
Any allergies to pets like cats?
No.
Any allergies to food and medication?
No.
Any seasonal allergies or allergies to seasonal things or environmental factors?
No.
Could you please tell me, do you have any concern right now about your well-being?
No.
Can you give me a brief description about your past health issues?
Well, I said I had pneumonia. That was all.
What about any past surgeries?
Yes, I had surgery. I had tissue surgery on my right arm.
Could you please explain about the right arm surgery for me?
Well, I had pulse and it was so painful and it was swollen.
Some kind of infection?
Yes.
Okay, what made it worse?
Well, activities.
What made it feel better?
Well, when I went for the surgery.
So when was the onset of the pores?
I would say it lasted for about a week.
So how were you treated of this pneumonia you mentioned to me before?
Yes, the pneumonia, they gave me some antibiotics and analgesics.
Okay. Have you had any tetanus shots?
No.
What about flu shots?
No.
What about pneumonia shots?
No, I had flu shots.
Can you tell
January 29th, 2013.
Okay. What about shot for pneumonia?
No.
What about any shot for hepatitis B?
No.
Any kind of screening or test for tuberculosis?
No.
Have you had any communicable disease like measles and chickenpox?
At the age of 8, I had chickenpox.
Okay. Can you tell me about your past hospitalization?
Well, that was for the surgery, an admission for the surgery.
Okay. Any kind of complications from the surgery?
There was no complication.
Any visit to the ER?
Yes, when it started.
In 2011?
Yes.
Okay. Can you please tell me, have you had any invasive procedure, something that is so painful or, that is risky to your life?
No.
Have you had any kind of accident or injuries?
Yes, I had a motorcycle accident in 1975.
So tell me, give me, what is any kind of injury sustained during the motorcycle?
Yes, I had an injury. I got this one, and at the same time I have bruises on my shoulder.
What makes those injuries worse?
Well, fresh wounds. Painful.
Okay, what made the wound better?
When I was treated.
Okay, so how long did it last?
Well, it lasted for about 2 weeks.
And what treatment did you get for the injuries?
As fresh when they treated them.
With what?
Well, I won't say healing powder and all the rest of them.
Okay. Have you had any kind of harmful injection of food poisoning?
I had food poisoning. In 1989, I took food poisoning through burns.
Okay. What was this? Describe it for me.
Well, after taking it, I started vomiting and stooling.
Okay.
Constantly, and I became weak.
So what made it worse and what made it better?
Well, intake of water made it worse. When I went to the hospital, I was given drip.
Okay. So that is how you were treated of it?
Yes.
Okay. For how long did this whole food poisoning issue last?
For about 4 days.
4 days. Do you have any prescribed medication from doctor?
No.
Any over-the-counter medication?
No.
What about vitamin supplements?
No.
Any herbs?
No.
Do you do some therapies like acupuncture, chiropractor, or oriental medicine?
No, no.
What about spiritual prayers?
No.
Are you on any kind of special diet?
No.
Do you do traditional medicine?
No.
I'm going to ask you a question about your family. Are your mother, father, and then grandparents, are they alive?
They are all dead.
What caused their death and at what age?
Well, they died at old age. They were above 80.
Okay, what really caused their death?
Well, old age.
Okay. So no kind of disease or illness?
Except my mother that was asthmatic. But that was not working well.
Okay. What about your aunties and uncles on your mother and father's side? How many are they?
On my father's side, I had 3 uncles. No aunts. On my mother's side, I had 6 uncles and 1 sister.
Are they all alive?
They are all dead.
At what age, what killed them?
Honestly, they were above 80 before they died, each and every one of them.
Okay. Can you tell me, and they didn't have any particular health issue?
No health issue.
What about brothers and sisters? How many do you have?
I have 4 brothers and 3 sisters.
Are they all alive?
No, one died this year as a result of alcohol.
Do you have kids, children?
I have 7 children.
How many boys and girls?
I have 5 boys and 2 girls.
Are they all alive?
They are all alive.
Do they have any particular health issue?
No.
What about husband? Are you married?
I'm married.
Is he healthy?
He's hypertensive.
Okay. Do you have any kind of family allergies?
No.
What about asthma?
No.
Any family history of hypertension?
My husband is hypertensive.
What about any family history of heart disease, stroke?
No heart disease.
Diabetes?
No.
Cancer?
No.
Thyroid disease?
No.
Any blood disease like sickle cell?
No.
Obesity and vision problem?
It doesn't exist.
What about hearing problem?
No.
Any bad defects?
No.
Some kind of seizures or mental retardation?
No.
Any emotional problem that runs in your family?
No emotional.
Any problem like drug abuse and alcohol abuse?
No.
What about asthma?
My mother was asthmatic, as I told you.
Okay. Do you have any concern about your family health issues? Any kind at all that is of a concern to you?
No.
Can you tell me, who do you live with at home?
I live with my daughter and my husband.
So, I'm going to ask you about your occupational history. Are you presently working?
No, I'm retired.
Okay. In the past, can you give me a brief past history of where you worked?
Where I was a teacher.
Okay. Within the environment where you work, is there like any exposure to some kind of violence or health risk?
No.
So have you tried in the past when you were working to change your job because of any health issue?
No, no.
Your family resources, are they enough to meet your family needs?
Well, it was enough.
What about, do you have any family insurance that is able to cover both primary care or care of physician needs and also inpatient and outpatient procedures?
Presently, I'm using the care loan.
Okay, does it cover the whole family?
It does.
Okay. About educational level, what is your highest education?
Well, I am a graduate.
Can you tell me the date of completion of your high school, primary school, and graduate?
I finished my primary school in 1961. Then my secondary school in 1970. As a result of the war, I graduated in 1991.
Do you drink alcohol?
No.
Tobacco?
No.
Do you do carbonated beverages like coffee?
No.
Do you do street drugs?
No.
On a good day, how often do you sleep? How many hours?
I sleep for 7 hours.
Are there any kind of disturbances you have when sleeping?
At all.
Do you exercise or have any extracurriculum activities or leisure patterns?
Yes, I do.
So what do you do for leisure or activity or exercise?
I read.
You
I
read?
go to the garden.
Okay. How often do you do that?
Well, regularly.
So how many times in a week or a month do you do that?
Well, in a week I can be there for 2 or 3 times.
Okay. Do you do any kind of exercise that requires a lot of energy,
No.
like walking, swimming?
No.
What about any kind of exercise that doesn't need a lot of energy or oxygen, like weightlifting or sporting?
I play badminton.
Oh, you do play badminton?
Yes.
Okay. How often?
Well, 1 hour each day.
1 hour each day. Okay. On a very good day, can you please give me what you eat for breakfast, lunch, dinner?
Well, for my breakfast, I take tea, bread and fish. For my lunch, I take gari and vegetable soup. In the evening, I can take rice with vegetable.
So how much fruits and vegetable do you eat in a day?
Well, in a day, I will say in the morning I take 2 oranges, in the afternoon a bowl of vegetable, then in the evening I take 2 apples.
What about snacks? Do you eat snacks in
Yes.
between meals?
Yes, I take snacks.
What kind of snacks?
Well, light snacks, I use baked potatoes, some groundnut and pap.
Okay. How often do you, in a week, how many times do you go to the restaurant to eat?
I don't.
How much fluid, water or any other kind of fluid do you take in a day?
I take an average of 8 glasses of water.
What about calcium intake? How much do you get from other food like milk and for your
I
calcium
drink
intake?
milk, 2 glasses each day, morning and evening.
Okay. Is there anything that stresses you out?
Yes.
What is it that you use to cope when you are stressed out?
When I'm stressed out, I sing or read.
So what is it that stresses you out?
When I'm provoked.
Do you seek any kind of outside help, like with a clergy or mental health professional?
No, not at all.
Has any of your friends or family members or yourself been exposed or witnessed any kind of abuse, domestic violence, or any kind of people calling you names or say things you don't like?
No.
You told me that you're about 64 years old and you're of the middle adulthood. What is it that gives you the most satisfaction?
Well, when I'm with my children and my grandchildren.
Okay. Tell me, when you drive, do you use car seats for your kids or
I don't
do you
drive.
sit down? Oh, what about when you ride bicycles? Do you use helmets?
No, I don't use helmets.
In your house, do you have smoke detectors or carbon dioxide or
We have
monoxide?
smoke detectors.
Oh, what about guns?
We don't have guns.
Is there any kind of health hazard like exposures to crime and violence at your workplace, in your neighborhood, at your home?
No,
What about pollution,
we don't.
lead and radon exposure?
No,
Any kind of exposure to secondhand smoking?
no.
So you mean at home nobody smokes in your house?
No one smokes in my house.
What kind of water do you drink?
We drink tap water.
Is it okay and safe for you to
It's
drink?
okay and safe.
All right. What about, are you affiliated to any kind of religion?
No.
Is there anything
Well, yes, I'm a Christian. Basically an Anglican.
Oh, okay. Is there anything about your religion or your faith that will affect your health care?
No.
Have you had any kind of fever or chills in the past or present?
Well, I had fever in 2011.
Okay. Describe the fever for me. What is it like?
When I was running temperature above 100
When,
degrees.
when did that start?
Well, I will say on around 4th of October.
Okay. What made it worse?
Well, I won't say what made it was it was a sort of temperature.
Okay. And what made it feel better?
I was given drip in the hospital.
Oh, okay. Did it affect your activities?
That at the time it started, it affected my activities because I was sleeping on the bed.
Okay. Have you been kind of fatigued, so weak or malaise, or have some night sweats?
Yes, when I walk myself and get I'm fatigued in the night.
Okay. Can you describe it for me?
I become very weak. My joints will be paining me.
Okay. So tell me, can you show me the locations of the pain?
Well, at the joints, the legs.
Okay. What made it better?
Well, when I have nice sleep.
Okay. What made it feel worse?
When I continue, when I know that I'm weak and I still continue to walk.
Did it affect your well-being?
Well, not much.
Okay. How much do you weigh right now?
I am 164.
Has there been any kind of preferred weight you want, or any sudden change in weight?
I know I want to be 165.
So have you gained or lost any of those?
I'm gaining weight right now.
How much?
Well, I was weighing 58 before, and I'm now 64. So I have 10 pounds.
Is that 10 pounds? You mean 68 pounds? 68 pounds, or like
168.
Oh, 168 pounds.
Yes.
Right now.
Mm-hmm.
Okay. Are you in pain right now?
Yes, I'm in pain because that's why I came to the hospital.
On a scale of 0 to 10, can you rate your pain for me?
I would say 7 over 10.
Okay. Have you noticed any kind of changes in the quality and distribution of your hair?
No.
What about your scalp?
No.
Have you noticed any kind of changes in the condition of your skin?
No.
What about any changes on your toenails and fingernails?
No, not at all.
Have you noticed any kind of changes, like noticed some moles on your skin or any part of your body? How often do you use the sunscreen?
I don't use sunscreen.
Okay, do you use eyeglasses?
I use eyeglasses.
Tell me why you use eyeglasses.
Because I don't see far objects.
Okay. When was your last eye examination?
In 2011.
Do you have a history of glaucoma or cataracts?
No.
Any other eye problem?
No.
Do you have a problem with hearing?
No.
Any kind of pain when in your ear?
No.
Any discharge in your ear?
No.
Any kind of ringing or spinning in your ear?
No.
Any hearing aid you use?
No.
Have you noticed some kind of discharges?
No.
Okay. Do you have any kind of, have you had colds or running nose in the past?
I don't.
What about present?
No.
Do you have any sinus pain like here on your forehead?
I don't.
Do you have any kind of history of nosebleed?
No nose bleeding.
How often do you brush and do dental floss?
2 times a day.
Okay. Have you had any kind of dental, when was your last dental examination?
In 2011.
Any missing teeth?
No missing.
Any cavities?
No cavity.
Any kind of dental problem at all?
No.
Have you noticed some kind of stiffness on your neck?
At all.
Any kind of swelling?
No swelling.
Any lumps or tenderness in your neck?
No.
Are you able to do a self-breast examination?
Yes.
When was your last mammogram?
I've not gone for mammogram test.
Okay. Have you noticed some kind of lump or soreness in your breast?
At all.
Any kind of discharges?
No discharges.
Have you had a history of shortness of breath?
No.
What about any history of wheezing and coughing?
No.
When you cough at all, do you have any productive cough?
No.
Any history of asthma?
My mother was asthmatic.
What about you? You have a history
I
of
don't have asthma.
any chest pain?
No.
Any hypertension?
No hypertension.
Do you have a history of unusual house sound, or your doctor has told you any?
No.
What about when was your last cholesterol check?
Well, that I said till 2011 because that's when I went for every check.
Is it normal?
Well, it's normal.
Have you had any history of diarrhea or constipation?
No, so there is constipation.
Do you strain when you stool, when you try to?
No.
What about nausea and vomiting?
No.
Have you had any abdominal pain?
Not nothing.
What about any food intolerance?
I don't have any food intolerance.
Have you had any kind of rectal bleeding?
No rectal.
What about around your rectum or groin area? Have you noticed some kind of swelling?
No.
Do you have painful urination? When you pee, you feel a lot of pain?
No, I control my urine and my pee.
Any blood in your urine?
No.
Are you able to know when you want to pee?
Yes, I
So
control
no
it.
form of incontinence.
At all.
Any urinary infection history?
No urinary infection history.
Have you noticed any kind of flank vein around your urinal area?
No.
Any vaginal discharge?
No.
Any sexual transmitted disease?
No sexual transmitted disease.
When was your last menstrual period?
My last menstrual period was in 1989.
The month?
I was October.
When was your first menstrual period?
Well, in 1964.
Can you tell me which day, which month, and which day?
I will say March, but I can't say the date.
Okay, how is the cycle flow? Is it like every 28 or 27
It's
days?
normal.
Okay. Have you had any kind of cramping when you were menstruating?
No cramping.
Any premenstrual symptoms?
No premenstrual symptoms.
You said you have children. Did you have any vaginal deliveries?
Yes.
How many?
10.
Any cesarean deliveries?
No cesarean delivery.
Any premature births?
No premature birth.
Did you have any abortions?
No abortion.
How many number of pregnancies do you have?
10.
In how many are alive today?
7.
Any complications during pregnancies?
No complications.
What about after the birth of your children? Any kind of depression?
No kind of depression.
Did you have any fertility problem or desires to have children?
Well, no, I didn't have any problem.
Okay. What about history of contraceptives?
I didn't use any.
When was your last pap smear to check for any human papillomavirus?
I have not gone for that past examination.
Do you have a history of anemia and bleeding?
No.
Any history of blood transfusion?
No.
What about thyroid problem?
No thyroid problem.
Any unusual feeling of cold or heat?
No.
Do you pee a lot?
I don't.
Do you eat a lot?
No.
Do you drink a lot?
I don't.
So on a good day, what kind of mood do you have?
On a good day, I'm always happy.
Okay. Any mental health problem?
No mental health problem.
What about anxiety and panic?
I don't have any
Any
anxiety.
depression?
None.
Any mood swings?
None.
What about hallucinations?
No hallucination.
Have you thought about taking your life?
None.
Any eating disorder?
None.
Or have you had any treatment for eating disorder?
None.
Is there anything about your head that is of a particular concern to you?
None.
Tell me, are you able to move your hands and all your joints freely?
Yes.
Okay. Have you had any swelling or weakness around your joints?
None.
Do you have any pain in your joints and back?
None.
Do you have problem walking?
I don't have problem.
Have you ever thought like when you're walking you are afraid that you want to fall?
None.
Are you able to do all your activities like dressing, toileting, walking?
I do.
What about shopping?
I do my
Are
shopping.
you able to prepare your meals?
Yes.
Do you use any assistive device?
No.
Do you need a caretaker or someone to assist?
No.
Okay, this is gonna be a little bit sensitive. Are you sexual? Do you have, in terms of sex, do you have sex with men or women or both?
I have sex with my husband.
Okay. How many past and present sexual partners do you have?
1.
Do you use condom and phones?
We don't.
Do you use any contraceptives?
We don't.
What of oral sex, anal sex?
No.
Do you do vaginal sex?
Yes.
Okay. Have you had any head injury?
No.
Any loss of consciousness?
No.
Any loss of coordination?
No.
Any kind of dizziness or numbness?
At all.
Any tingling or seizures?
No.
Any kind of shaking or headache?
No.
Are you kind of irritable sometimes?
I'm not irritable at all.
Any kind of mood swings?
No.
Any kind of cognitive impairment?
No.
What about memory impairment like short-term memory?
No.
Okay. We've come to the end of this interview. Thank you very much. Whatever we have here today is still going to remain confidential. I've had information you've given me information about your shoulder pain and also your family history and work history. And whatever we discuss will remain confidential. Thank you very much.
Thank you too.